Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to Talking Head Pain, the podcast that confronts head pain head on. I'm your host, Joe Coe, and I've been a migraine patient for over 20 years. The revolution is happening in your doctor's office. For decades, people that lived with migraine didn't have many options. Today, that has changed. I'm here with two leading neurologists, Dr. Saikali and Dr. Andrew Blumenfeld, and we're going to share with you what this revolution means for both patients and providers. How are you both doing today?
Good. Nice to be here, Joe.
Yeah, doing great. Thanks, Joe, for having us.
So let's start with Dr. Blumenfeld. How does a visit today compare to a visit 10 years ago or even 5 years ago?
Well, we've seen a lot of dramatic changes. What happens today is we have very specific medications that can alter the way the patient's lives are controlled by migraine. And the visit now works around gathering the data that we need to secure those medications for the patients through the payers, and making sure that they meet all the requirements so that we can get them started as soon as possible. So the way we take the history, the way we educate patients has shifted dramatically from the triptan era, which would be 5 or 6 years ago, when we had medications that did help, but they had lots of side effects and they were hard for patients to use. And this newer class of medications, the gepants, are much more efficacious in terms of the fact that patients can take them and see the efficacy because they don't get the side effects.
That's really helpful and I know has been a game changer for so many people, myself included. Want to turn to Dr. Saikali. What type of information should patients share with you when they come to a visit? We might think it might not be particularly important or connected to migraine, but what are some key pieces of information that we should be sharing with our providers?
Yeah, Joe. So there's a lot of missing parts to medicine and to science, but going to your doctors isn't as easy as people think in regards to sharing information, where there's shared information with providers across, even if it's in the same city, let alone another state. But patients always ask me, did you get this information about me? Did you get this doctor's note or did you get this test result? And you'll be surprised at how many times we're unable to obtain it or we just never receive it. And it's a disappointment because it hinders a visit that people take time off from their jobs, from watching their kids or whatever it is that they come to the doctor's office wanting to get help, but yet they don't remember all the medications that they've been on, the studies that were done, because they feel like the information should have been there before they get to the visit. So it's surprising to me as a provider who's been practicing for over a decade that in this day and age, we still don't have all the information when the patients come in. So it's very important for the patients to always have a list of what medications they have tried, what side effects they've had from them, or how long they've tried it for without being efficacious. So it's important for them to take charge of their medical history and have copies to all providers that they need to see, not just in the headache world. So information that they can bring, whatever they can, from all the visits that they've had and all the medications, even if it's as easy as they choose the same pharmacies they go to, have a list, print out a list from their pharmacy of all the medications that they've tried. That helps us out a lot more and makes the visit just more productive for both parties.
So that's a really important information that you just shared to come to your appointment prepared. You mentioned taking a printout from your pharmacy. There are apps too that folks can use. I know at GHLF, we have one called Patient Spot that people can input the medications that they're on and have it on their phone to show their doctor. But really, it's about creating that relationship and maximizing the time. As patients, our time is limited. As providers, your time is limited. So the intersection of maximizing our time together is really important. With that same idea, I want to turn to Dr. Blumenfeld to talk about how we can become partners in care. How does a patient and provider join forces in this revolution to strive and work toward migraine freedom?
Yeah, so the partnership obviously starts with that first visit, and it's like walking down a road together, and there are many different branch points in the road and obstacles, and we have to navigate those and work together in order to progress forward. The ultimate goal is to try and get as close as possible to migraine freedom. And what migraine freedom means is that the patient has good control over the disease. It may not be that they have zero migraine. It might mean that they don't have to go to the emergency room and they're able to go to work and take care of their family. That's sort of a lofty aspiration, and we set that expectation up front, and we focus on getting to crystal clear days. So crystal clear day would be a day where you have no headache, your thinking is clear, you're not suffering with side effects from your medications, you're feeling, energetic and clear-headed. And this is the ultimate goal, is to have as many crystal clear days as possible. And we need to make adjustments in medications as we walk down this road. And we need to layer medications on top of each other. And we also need to set the stage for the treatments to work well. And setting the stage means removing anything that might be driving the headaches. For example, let's say you are overusing caffeine or overusing an acute treatment that could aggravate the situation and maybe make the more specific treatments less effective. So we need to look for all those angles, as well as any other condition that might be worsening the headache disorder. For example, if your thyroid's not working well, or if you had sleep apnea, these things can all drive the headaches to a higher level. We have an approach that is algorithmic, where you walk through all these different stages to get as close to this crystal clear state that I was discussing.
There's a couple of things that I want to talk about, and Dr. Saikali, you could jump into if you have any thoughts. In terms of the crystal clear days and comorbid conditions, how does a neurologist or even a general practitioner handle addressing the comorbid conditions, and what motivates a patient to address these either underlying conditions, comorbid conditions, or conditions that exacerbate migraine? Because it can feel very overwhelming.
Yeah, it's a great point, Joe. I mean, you don't know what symptoms they're feeling from what condition they have because they're all interrelated. There's a lot of interrelation with these disease states, and comorbid conditions that exist includes, in my opinion, one of the most common and one of the most underdiagnosed is sleep disturbance. So how I put it to patients is that you have a puzzle and you have many different pieces to the puzzle. Everybody's puzzle is different. Here are a lot of your pieces. It's not one big piece that fits the puzzle. We have to put that puzzle together. Some pieces you're going to be able to put on easy to fix on your own, and some I'm going to help you with to figure out, and we got to figure out together. So making them understand that it's not going to take just one sitting to put this puzzle together, and we need to work together and maybe have follow-ups with the rest of the team. It doesn't have to be even just myself, and maybe a PA or an NP that they're going to be following, but they're all part of the team to help put that puzzle together to achieve that migraine freedom and to achieve that crystal clear day that Dr. Andy Blumenfeld was talking about, who actually came up with that term with the crystal clear days. I think it's a great concept of we never thought about in the past. It's not just a headache phase. There's different phases of the attack in a migraine that can involve cognition, that can involve personality, that can involve GI issues, that you want them all to be resolved in as short time as possible with as little medication as possible. And that's what develops, and that's the understanding of having a crystal clear day. How many crystal clear days do you have in a given week, in a given month? And so it's not just that migraine disease state. You want to try to treat other comorbid conditions altogether, but it's not going to be that easy, unfortunately. It's not going to be one sitting. We all know that.
And does medication work better if we're addressing these other comorbid conditions?
Sure. If you don't address those comorbid conditions, it can become a vicious cycle because those conditions might be aggravating the headache, which would lead you to take more medication, and some of those medicines might aggravate the headache. So there's a big interplay between comorbid conditions, the medications you use, the frequency of your headache, and then just having frequent headache can also be a driving factor. So each migraine helps to bring on the next migraine. And so you get into these vicious cycles, and we have to break that cycle. Fortunately, the newer specific treatments, the CGRP drugs, whether that be the monoclonal antibodies or the GPANs, they're very effective because they don't have a lot of side effects. They have high efficacy. They tend to work quickly, and they can work in this type of setting where they can break these cycles, and they become a foundation. And then you can build other treatments on top of that. If there's depression, if there's anxiety, you're going to be treating that with more specific medicines for depression and anxiety. But you use the CGRP specific migraine treatments to kind of be the foundation of your buildup of all these different treatments.
I think that's so important to state, and I could just share from my experience as a migraine patient who was extremely overweight and had a lot of different health conditions that were being fed by both living with migraine, being overweight, metabolic syndrome, all these things that were a cycle, like you just said, and getting on the right migraine treatment, while it didn't cure me of these other issues, it provided me the opportunity to address them. I still needed to address them. I still needed to figure out my relationship with food and figure out my relationship with movement. But migraine became less of a barrier to doing that because these medications work better than the older medications that I was on. So I think that that's something that we need to tell folks, that this is about looking at yourself as a whole person, figuring out what type of life you want to live. Do you want to be limited by migraine? Because the reality is that for a large percentage of people that have migraine, and correct me if I'm wrong, getting on these treatments can likely dramatically increase their quality of life. So the question is, why aren't we seeing more people get into this revolution, feel energized, and say, I don't want to live a life in pain. I want those crystal clear days. I want to be able to enjoy my life to the fullest, however I define that.
It's a critical question. Why is it that there are so many people with migraine that firstly don't realize they have the disease, and secondly are not on these treatments that work well and are well tolerated? Obviously not in everybody, but in a large percentage of patients. And it's a dilemma. Is this a dilemma because physicians are not well versed at diagnosing migraine or not well versed with the newer medications? Is it that there's a stigma around the disease and there's resistance for patients to accept the diagnosis and to seek out care? Or maybe it's a combination of all of these things. But I think the stigma probably plays the biggest role, and we really need to find a way to break down migraine stigma so that patients can come to the doctor thinking and accepting that they have migraine and seeking out these treatments because they can make such a big difference.
I agree, Andy. Joe, I think the stigma is very big, and people still say, why do people have stigma still? I think this is still very new. If you want to date back, it's only since 1992, before you were born, Joe. But, 1992, first migraine-specific kind of medication came out with Imitrex as a abortive therapy. There's still people out there that have never even tried Imitrex or never even heard of it, and have been living with migraine disease, and their parents or grandparents have had a migraine and tell the rest of the family, oh, I've had this, just get in a quiet, dark room and just try to sleep it off. You should feel better the next day, or in a couple of days, you'll feel better. They don't know that there's medications out there that can help them. They don't know how important it is to treat a migraine. Just like Andy said, a migraine begets a migraine if it's not treated appropriately. And to give you a statistic, if a migraine is not treated with a migraine-specific medication, you have episodic migraines, which is less than 15 a month. You have 3 times more likely to transform into a chronic migraine, which is 15 or more headaches in a month. And so they don't understand that. They don't understand that there are treatment options. We should be treating migraine. How I teach a patient, you need to treat your migraine because we think it could scar the brain. And then I think that's what, I don't mean to scare them, but I need to make them understand that you don't have to just sleep it off. I don't want you to just sleep it off. I want you to have a better quality of life.
I'm curious to hear from you both about something I have in my head around uptake of these new medications versus old. And it's kind of the inverse of what you were just saying. So because older medications have been around, people might feel more comfortable with them. Something something that I've heard from people that are not seeing neurologists but live with migraine. They never heard of these medications and they're like, I don't know if that's something I want to take because it's new and it might be scary because they don't know a lot of people that are on them. So how do you address that with patients that might be a little hesitant around the newer medications because they don't have a friend that was on them or their mother didn't take them?
Well, I think this understanding that migraine in some patients is a progressive disease where they may transform to this more frequent type. So once you start to think about the disease like that, it pushes you to become more aggressive in the way you manage it. And if you're taking one of the older medicines and you are achieving migraine freedom, you're not having any headaches, the medicine's working well, you're tolerating it, you don't need to make a change. The subgroup of patients, though, that is either getting a lot of side effects or is not responding to a pain-free state, they need to rethink that situation and push to get the more aggressive, more specific treatment, because there's a chance with the newer treatment that they could achieve that pain-free state. So they should continually look for it. And the way that I tell patients to check is that when they come back for their follow-up visit, they want to see, after they took their acute treatment, 2 hours later, were they completely free of migraine symptoms. So no headache, no nausea, no light or noise sensitivity. And if they're achieving that, great, stay on the treatment. But if they're not, then let's shift you to the next level up. Fortunately, in the newer treatment group, we have far fewer side effects. So when we look at treatments and we kind of judge them, there are two angles. And it's best summed up by looking at an equation of effectiveness. Effectiveness is this combination of efficacy and tolerability. What I've been teaching patients in this new era is that they shouldn't be brave, that they should not wait to treat. It's far more beneficial with these newer medicines to treat early in the attack and not let it linger, because the longer the attack is lingering, the more likely they are to progress to the higher frequency of migraine. So early treatment is crucial. Some of these GPANs have now been studied even in prodrome. So that means treating before the headache even begins, when you're in the warning phases. And the data shows that they work well. So treating during prodrome is beneficial if you can learn about your prodrome. So learning about what symptoms you get just before the headache starts. Things like fatigue, excessive fatigue and yawning and slow thinking, light sensitivity, noise sensitivity, a dizziness, neck discomfort. And now the guidance is treat during prodrome, or if you miss it, treat as early as possible in the headache. Never wait. So a very different way of managing patients than previously.
I agree, Andy. Joe, I was listening to about like what you were asking in regards to how to get these patients more comfortable into the newer type of medications. I don't know how, Andy, how you feel and how you discuss with patients of when they ask you, well, these are newer drugs. How do I not know I'm going to grow a third eye from these newer drugs? And they've only been around for a few years. And to Joe's point, they want to try the older drugs. If they haven't tried them, it's worth trying. And we, a lot of times we tell them, yeah, those have been around for many years. And I go through the history of drugs going from what defined really in our definition, chronic migraine. I know Andy, I think, agrees with this, that Botox kind of defined the chronic migraine disease state because that's what it's indicated for. And I say, Botox is one of the older ones. It's been around for decades. Hundreds of thousands, millions of people have tried them. And the same Botox, my saying, is the same Botox that they use in Hollywood for cosmetic ways. And if Botox was really bad for you, Hollywood would not exist. That's one option. That's one thing how I make them more comfortable with that treatment option if that's what they want to go with. If they want to go with the monoclonal antibodies, I take them to data of long-term open label extension studies, and I tell them, they saw no new warnings, no new side effects, even in the open label 3-year and 5-year. We have data, especially with the first monoclonal antibody that came out in 2018. But to make patients more comfortable, I think it's partly the provider, what I call the provider effect. It's a collaboration of physician-directed kind of collaboration between basically the provider or the physician and the patient. And it also just educates the patient on what really good can really be looking like and remove these barriers in patient care and making them understand that we need to look more towards migraine migraine freedom. And everything is a trial and error. I don't know what can happen in the future.
Yeah, that makes total sense. And something I struggle with because I hear people and I see people and people that reach out to us at GHLF who share their story and they're not being treated in the most innovative and effective ways that we know. And some of the hesitation is around, I don't know about those drugs. So we do our best in sharing that data and understanding and also acknowledging patient preference and all the things that go into that. There's two questions that I have left for this amazing podcast episode that is so enlightening and impactful. One came up as I was listening to you, Dr. Saikali, talk about brain imaging and scarring. When Global Healthy Living Foundation started in 1999, we started as an arthritis organization called Creaky Joints. And people with diseases like rheumatoid arthritis at that point, many would be in a wheelchair or very crippled, have joint deformities, things that looked really bad. And we were able to look at radiographic changes in arthritis patients. Biologics came to the market and that changed. Our community looks very different today than it did in the past. We don't see the same joint deformities and degradations that we've seen in the past. I believe, as a theory, that has motivated patients to get on treatment was that you're able to understand and see the progression. You could see those in radiographic images. With migraine, it's a little harder to explain that same progression. So while we don't have imaging necessarily, but we do have the concept of episodic to chronic disability, the crystal clear days to strive for. How do we paint that picture in lieu of or without these very strong physical manifestations that we can measure?
It's a good point. I wish we could do it by neuroimaging and seeing a regression, which we unlikely will see on neuroimaging and looking at the white matter and the T2 changes and see them regress, but we may see them not progress, right? And those studies, I think, are still being done. I don't know any yet up to date. I don't know if Andy can back me up on this, but up to date with the newer types of medications, treating migraines and being more efficacious, being more compliant because they're tolerable and less drug-to-drug interactions. If these medications that patients are being compliant with and treating their migraines sooner and getting less frequent and less intense migraines is decreasing the progression of the T2 changes. That, to my knowledge, we don't have. I think it would be a great study to pursue and longitudinal kind of study that needs to be done, but not yet. And we'll look forward to that. But in regards to how do patients look forward to maybe thinking about to achieve crystal clear days, I think they need to keep a better journal. I know many patients don't keep as good of a journal as we would like them to, but there are a few that are maybe more of a type A personality and they keep a journal and they keep, I think, too much. I think they go to all the way on one side versus the other side where they write everything down. They become engulfed into writing every single thing down, whether they have a migraine day or headache day or headache-free day or migraine-free day. So there's a fine line onto, I think, trying to figure out, has this affected their quality of life? Are they missing less work? Are they missing less ER visits? Are they calling their physicians or providers less because their headaches have become less intense or less frequent and they're having more crystal clear days? I don't know if that answers your question.
It does. And I'm the bad patient that refuses to do a diary or a journal. I've found other ways, and I want to share just some other ways that you can look at this because it does work. And I'm a health coach outside of GHLF. I'm a personal trainer, so I understand how people get motivated to make life changes. And some people are very driven by that data, and that'll be motivating, and some will find it to be a burden. For me, I look at small and large wins. Am I waking up without a migraine for a month? Do I think about migraine? If I can reflect on those things and I can answer, no, I haven't really thought about migraine, I'm doing something right. If I can get on a trip overseas and be able to function, and I will likely have to take medication while I'm doing that, but with the medication, if I'm able to function, I'm doing the right thing. If I'm able to go on that hike, if I'm able to exercise in the way that I want to exercise, those are the things that I have looked at as success and that I have defined for me. Because I think what we fail to acknowledge when we're looking at behavior change is, what is the motivation? So what is the motivation to not settle? And if we don't really understand the motivation of the individual to not settle, then we're going to settle. And I had to come up with my motivation was, and my motivation was I'm living a youthful, vibrant life. And I wasn't when my migraine was not controlled. It contributed to a spiral of really bad health outcomes for me. So being able to look at that and reflect, I think is really important. And one way, and I think journaling is great. I don't want to diss journaling. I know that it's a really important thing. If you're not into journaling, find your own way to monitor and benchmark your health journey, because it's personal to you and you need to understand what matters for you as a patient, and then tell your provider, this is the life that I want to live. How do we get there? So how do we get there? How do we not settle? How do we optimize our health?
Like you said, you don't need to keep a journal your whole life. Have a goal of like maybe 2 months and just do it for 2 months. I think success, as you said multiple times, Joe, I think success of getting more of a grasp of your migraines is not having to worry about scheduling appointments or dates or missing work, not having to worry that you might have a migraine attack. If you get to that stage, I think you are doing something right. That's a great point.
Last words, Dr. Blumenfeld?
Well, I think that we want to encourage patients to think about migraine, to understand it's not a difficult diagnosis. I think that any recurrent headache that is disabling should firstly be thought about as migraine, not to default to other headache types, whether they be tension headache or sinus headache. And typically, if there's a little bit of nausea or if there's sensitivity to light or noise, that's usually sufficient to confirm the diagnosis. So it's not a difficult diagnosis to make. And then I would encourage patients to go and see their providers, primary care or specialists, and to seek out the newer treatment options, which are really the drugs that block this chemical CGRP, which is a chemical that's released in the brain during the attack and does play a big role in causing the headache. And these newer treatments block it very effectively and encourage them to think about starting them and being much more aggressive in their treatment management and also in their expectations for the control of their disease, to think about getting to crystal clear days with this deeper understanding that if they don't do all of this, if they just leave it and kind of just live with it, there is a risk of progression. And that is something we want to avoid, because patients who progress can end up having headache nearly every day. And there's no need for that. We can control the disease to a large extent. We can't cure it. We can only control it. So these treatments are long-term treatments, and one has to accept that these are going to be lifestyle changes that you're going to make. So I would take that into consideration and seek out providers that can help you get started on this journey.
Thank you. This was such a great discussion. And I think the next one needs to be on how we educate providers about all this stuff. Because what happens if a patient goes to their provider and they don't have the capacity to do a prior authorization, or they don't have the time to go over the entire history of the migraine patient's journey? So I think there's a lot to unpack, but we'll leave that as a cliffhanger for our next episode. I really appreciate the time and energy that you both gave today to talking head pain, and that you give every day to the patients that you see and the people that you change with your work and your professional societies, as well as throughout the research and all the other important things that you do. So thank you from the patients, and we appreciate your time.
Thank you, Joe.
Thank you, Jeff.
Thank you for listening to this special episode of Talking Head Pain, the podcast that confronts head pain head on. If you have any questions or thoughts or suggestions for us, we would love to hear them. You can send us an email at podcast@ghlf.org. If you enjoyed this episode, please give it an honest 5-star rating, write a positive review, and spread the word by sharing it with your friends and family. I'm Joe Coe, and I'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.